There will be a Q&A, and you can drop your questions in the side panel. So without further ado, Derek, over to you.
Excellent. Thank you, and thanks to everyone for joining us today on a workplace safety and sanitation overview. The real impetus for our time today came from the field. This came out of questions and concerns that we were hearing from the global workforce, from our customers, and we were very fortunate to have two quite distinguished gentlemen join us today. First, I'd like to introduce Dr. Bishan Porkamalian. Dr. Porkamalian holds his PhD in microbial physiology, his undergraduate degree in biochemistry. He is the Global Food Safety Director for McDonald's. He has oversight for both their supply chain and restaurant safety. McDonald's has certainly invested in maintaining an outstanding food safety reputation. They do this through collaboration. And Dr. Porkamalian, in supporting the event today, also works closely with academia, with other leading food companies. He works with the regulatory agencies to really helping to bring safety even outside of McDonald's and well beyond. Also with us today, the ever charismatic Dr. Sylvain Charlebois. Dr. Charlebois is the director of the Agri-Food Analytics Lab at Dalhousie University in Nova Scotia. Dr. Charlebois is a very active and well-published member of the community with multiple journal articles. He has authored 5 books on food systems, food safety, and sanitation. And he hosts a regular podcast under his pseudonym or his nickname of the Food Professor. So, gentlemen, I really can't thank you enough for taking the time out of your busy schedules. The commitment that you both show, both to the communities, to our industrial partners, is outstanding. We'll look forward to hearing from you as we get in. With that, my name is Derek Wernicke. I'm the Vice President of Quality Assurance for Ansel Corporation. Very happy to be here and be able to share this with everyone today. I'll start off, hit the next slide, with a brief overview on what we're doing or on our what we'll be going through today. We will look at some of the best practices in sanitation processes and how folks are responding to COVID-19. We'll get to hear from our experts on that. We'll look at how McDonald's has responded, the new practices that they have implemented. We'll go through the protocols to impact or to protect employees in the workplace. This has become a whole new issue that we've had to face within all companies and all across the world. Understanding the Canadian Food Inspection Agency requirements and viral regulations. The regulatory agencies are in the same pinch that the rest of us are, and they have done an outstanding job of getting critical and meaningful information out to folks. So we'll touch on that briefly. We'll look at the PPE supply challenges. PPE demand has grown substantially, and how are we responding to that? And we'll finish up with a panel discussion and address any answers that you have, or any questions. Sorry, hopefully we'll bring you some good answers. All right, with that, hit the next slide. So I'll touch briefly on a couple of things that Ansel has done in responding to this pandemic. And I feel oftentimes the word unprecedented is overused, but in this case, I'm going to say it's not overused. This is absolutely an unprecedented event. And Ansel has taken 3 key steps. Number one, and very importantly, we had to respond and implement our own internal safety protocols. So Ansel operates 12 factories around the world. We're a global leader in production of PPE. And of the 12, we have 8 what we call mega factories, where we've got over 10,000 employees working in our operations, working to produce and deliver the critical goods that folks around the world are using today. And our first priority was implementing broad, sweeping protocols within our factories to keep people safe. And very grateful to be able to share that our safety record has been outstanding through the pandemic. And that is everything from shields within our cafeterias to social distancing on our production lines, worker training, worker screening. So it's been a very successful program, and we have faced the same challenge that many of you have faced. Number 2, we had to address this sudden surge in global demand. The glove industry has been growing over the years at an average growth rate of about 8%. So a pretty steady, fairly predictable. In the span of just a couple months, it nearly doubled. We went from a global demand estimate of about a little over 350 billion gloves per year to nearly 600 billion. And I'll go through later also how we've responded to this with a relatively inelastic supply chain. So we've worked to increase demand, but it is also difficult to increase demand that quickly. And lastly, working with people, with our academic partners, with researchers, with folks like our panelists joining me today. But we've provided the guidance that our customers and users have needed to get through it. Protocols have changed, applications have changed, and it has been a very dynamic world, to say the least, over the last several months. So that's a little bit of the highlights, but and one of the things I want to touch on is how we are helping to provide that guidance. And if we can hit the next slide. Perfect. I want to touch on quickly our Ansel Guardian program and how we use a scientific approach to take what I look at it as the needs within a specific business or industry, and understanding and analyzing that particular business's needs and marrying it with the most appropriate PPE, and with three goals in mind. One, always the reason we're using PPE, how do we improve safety? Number two, looking at how the PPE impacts and hopefully favorably impacts productivity. Oftentimes the wrong PPE can seriously impede productivity. The worker may be safe, but it's not really that relevant if they can't perform their job. And lastly, looking at the cost analysis. And we've added to this Guardian assessment tools to address COVID-19 and the issues that we've faced there. And I'll highlight just a few of the areas, but one, of course, how PPE can protect the specific hazards within any particular industry or within the organization. That could be chemical protection, mechanical, sharps protection, and now adding in COVID protection. So if you picture a factory in the past, you are now seeing far broader use of PPE. So also we've got input for COVID, as I mentioned. We are looking at other applications, whether it's janitorial and sanitation, as well as the normal processes and procedures where folks have already been using and actively using personal protective equipment. Okay, so that's a bit of an overview on our Guardian assessment. Again, just a very scientific approach, or a way for us to interact with users and ensure that we really are putting the PPE in that meets a now broader set of requirements. Okay, if we can advance. Excellent. With that, I'd like to hand it over to our first speaker, Dr. Porkamalian.
Thank you very much, Derek. It's a pleasure to be here. So good morning, good afternoon, good evening. Since I cannot see where you are, I don't know what timeline you're actually in. Wherever you are, I hope you're keeping well and safe. And thank you very much for being part of this webcast. I'd like to first of all thank Ansel for inviting me to present here. It's an honor and a pleasure to be here and to share some of my thoughts and what the thoughts of McDonald's has been in the past 6 months or so when we have been facing this pandemic. First of all, let me just explain to those of you who don't know what McDonald's or who McDonald's is, which shouldn't be any of you out there, but however, McDonald's as a burger company, a modern restaurant company, actually is present in approximately 119 different countries across the world. And that is, let's say, using 39,000 restaurants to distribute our food products. And within those 39,000 restaurants, we're looking at approximately 2 million employees. So if you look across that and try to assess how to manage that number of people in such a variety of countries and cultures and procedures, it's going to become quite challenging. And I'm going to try to explain how we faced and overcame some of those challenges, and some of them perhaps are still a challenge that exists, and we need to find innovative or possibly inventions to overcome them. So what I'm going to do, if we can go to the next slide, to present to you what the agenda is today on my presentation. I'm going to talk about COVID-19 and the challenges that it presented to us in the past few months. Then try to explain some of the ways we try to adapt to those changes of the new norm that we are facing today. Then explain on the best practices and examples of what actually made it work well and what actually has moved us to a next level, like the things that you see in this picture here as an example. And finally, do a conclusion of what is important and what we believe to be of importance moving forward and being prepared for the next challenge. And we sure know that there will always be challenges just around the corner. As we were speaking about this a few minutes ago, actually, with the other presenters, the whole pandemic situation or viruses, etc., there have been many who have been happening. Since 2000, we've had SARS, we had avian influenza, we've had MERS, and we will have many more in the future. The important thing is that we recognize these challenges and we adapt and overcome them. And we can do that only if we work together. And it doesn't mean all McDonald's people working together. It means everybody on the planet. It doesn't matter what is your background, what is the industry you're working in. You always have to work together to overcome any kind of challenge that is facing you. So let's go on to the first one of the agenda of COVID-19 challenges. As you can see, I don't put too much words in there because you probably read them and then stop talking about it. So let us just discuss this as we go forward. The challenges that we see are not just about the pandemic, the virus itself. You have to consider, as we did, that we have spent years developing an environment in which people work very closely with each other. People of different cultures work closer together, and they actually provide food and very hands-on. And it's also working about bringing products in either from a local environment or from a global environment. The supply chain that goes behind the restaurants was taking years to build. And suddenly, when you face a situation where that supply is going to be interrupted because the borders close and you cannot get the food product or any other product across the border, what do? What contingency supply do you have to have in place? Also, when we're looking at the actual staff themselves, if we are going to a lockdown, as many countries did, how are we supposed to get them into work safely? Many of them do not actually have their own cars to drive. They trust public transport. But when public transport is not a safe way to go forward, how do we overcome that? And as a top of that, there's another balance that you have to take into consideration is the customers themselves will not be going out because they're also in lockdown. So even if we were supposed to get our staff into the restaurants, there will be no customers. As we saw in some of the markets across the world, some restaurants had to shut. How do you overcome those challenges of all of the food products? The food that is in the restaurant, the food that sits in the distribution centers, and the food that sits actually inside the suppliers. So all of these pile up. There's all many different challenges, and it's not just about people, it's all the food that actually is in the restaurant, but also the food that's been produced, the raw material that has already been processed and ready to be used in the future. On top of that, then you're looking after the health of your employees. How do you make sure that your employees are safeguarded? How do we make sure that the customers that are eventually coming to restaurants are also safeguarded and we don't pose a disastrous situation for anybody? So how do we make sure that everybody is safe, whether it's a customer or it's a crew member, a staff member? These are just a few challenges that we actually had to face and we had to try to overcome. But it goes even deeper than that, because when you start talking about if we do open the restaurants as we did, what precautions do we need to take? Gloves, masks, sanitizers, etc. How do we actually start creating new procedures training programs, sourcing the material. Most of the gloves or the masks that are around the world actually originate from China or from that region. When those countries are now shut down, how do you source this material? And how do you make sure that the material sourcing actually is the right specification and not just something that's been sold to make a fast buck by the person selling it? So all of the quality controls have to be in place to make sure those actually are in place as well. So you don't actually provide a personal protective equipment, for example, that is not meeting the mark. And that itself takes time to actually get a supplier to start up, to get the trust in them, to get the specifications sorted out and actually distribute it is actually a challenge in itself. So how do we overcome some of these and how do we adapt? So if you go to the next slide where we talk about adapting to the changes. One of the major changes that had to occur was about social distancing. Now in our restaurants, when people are working, you are very close to each other. Busy times, you cannot get away from each other. How do you change to that? So one of the things that we had to do was, of course, label on the ground, which you see them everywhere now with everywhere you go, any restaurant, any place you want to purchase anything. Even when you want to go to a bank, you got social distancing now. So these are some things we had to start working on. How do we label on the ground and allow people to actually have the social distance? Then on top of that, how do you actually train the staff? What is important, what is not? Why are they doing this? So it went back all the way back to education again. Start off with educating people, what are the risks and how do we overcome or handle or manage the risks? We all know that the risk is not eliminated. There's always a probability, but how do we reduce it and manage it is our key essence. So looking at social distancing was one of them. Second one we consider is how do we use the masks? Are the masks actually useful? There was a lot of information out there and not all of it factual. A lot of contradictions that masks are useful and some say masks are not useful. Do we take surgical masks? Do we take the masks which are just covering your face as a 3-ply unit, or do we go for the ones with the filters? So there was a combination of information out there that we didn't know how to get the right one. So we had to rely back onto what WHO says, CDC, or any other authority in the environment that we live in to provide us with the right information and accurate information. But there's also a problem with that too. This was a new strain of a virus, so not much was known about it. Therefore, the information was always building, so we had to be very fluid. And this is one of the most important considerations when you are in a crisis. You have to be very fluid. As new information comes, you have to be able to be flexible to adapt to the changes of information and the procedures. Learning that from now on, if you are going to be working, there has to be social distancing between the crew, which that in effect means that there's not going to be that many people working in a restaurant. So numbers are reduced. As a result, you cannot give enough food out as you do usually. So the queues are going to increase. So all of these have a domino effect, and you have to explain to the customers, explain to the staff how we are working and do the best. In McDonald's, one of the first things that was done when the restaurant opened up was reduce the menu item. So to be able to provide food in a fast and efficient way with the least number of staff in the restaurant. But also making sure that the restaurant actually is protecting the customer and the crew. Cannot ask the crew to come in where it is unsafe for them to do so. And when they do come in, provide them with the right equipment and tools to be able to use them. And of course, train them in them and overcome the challenges that may exist. There's also the understanding of the cultural differences. In some of the cultures, face masks have been used for many, many years. So it is nothing new. In others, it is not. In some cultures, in some markets, use of gloves is considered to be not appropriate because it seems like you're dirty, that's why you're wearing a glove. On the other hand, other cultures is understanding that wearing a glove is better for hygiene. So there are different cultures, so providing one standard for all doesn't actually work. So we have to look back and say, okay, what is the risk? How do we actually overcome the risk? But there are many different ways to overcome the risk. So therefore, we provide many different tools and procedures to overcome those. So you have to look out of the box and to understand about where are those solutions coming from. Do not actually look at your own self to understand, because a lot of the answers are actually not within the food industry. There are a lot of answers that come from the cruise ship industry. They've been sanitizing their ships for many, many years, and they have a very good experience. How do you do that? How do you basically clean a whole village when it's floating in the water? So understanding how others work and learning from them to make you change the way you work and adapting to the new norm. And that becomes so vital in making sure the business continues in a safe manner. As we do this, we find that there are many best practices we can pull upon. And I would like to share a few best practices that we encountered while adapting to change. For example, hand washing. If you have ever traveled across to Asia, you will see that in many restaurants, the actual hand washing basin is in the lobby, as well as the ones in the bathrooms and the toilets, etc. But you do find a lobby too. It's a cultural thing. So how can we bring that over to this part of the world? So here you see the picture actually in Europe having hand washing basin outside the restaurant before you even go into a restaurant. So learning from what actually other markets do and bringing that and using it as a best practice. Sometimes these are translatable to another country, sometimes they're not translatable. Sometimes they're not practical and it cannot be done as easily because of the way the structure of the actual building, for example. Providing information to customers in many different ways. And we look at posters, we look at the kiosks, we look at videos, we look at our own people greeting and providing information. Any which way that information can be provided for the customers to remind them of what is best practice, hand washing as an example, or hand sanitizers when they need to do it, keeping a social distancing going. All of these things are key. But behind these reminders also comes education, and not just education of new employees, but re-education of the staff on hygiene and safety. One of the key factors that we realized throughout the whole pandemic is that how good it was to remind people that hand washing is so simple yet very effective, and how we can actually make sure that all of the units used for hand washing are actually properly sorted out and working properly. For example, here you see in a picture a paper towel being used. If you go to many places and bathrooms, you do see hand dryers. But we did learn from WHO and CDC and ECDC that there is a possibility that the air droplets could actually be spread even further in a small environment with air dryers, especially when they're high velocity. But the best option would be to go to paper towels. So we moved and we changed and into having paper towels, and we're going across the whole of our system, changing that over to make sure that we do not increase the risk, but actually reduce the possibilities of the risk spreading. Increasing the frequency was one of them. The best way to do is regularly and more regularly clean. We've seen from the information provided that cleaning more regularly is actually the best way forward. So increase the hygiene activities. And of course, delivering to local and social cultures as they need it, because it is so important that we do not go against the culture of a country and the social standards that exist. Having one standard coming out of the global corporate office into the whole 119 countries would not necessarily work like that. We have to work with all of the countries, regionally or locally, to make sure that we do not infringe on anyone's social or cultural needs and actually provide the solutions that they are actually looking for. I think that is where we come into a very, very difficult and gray area, because cultures are very different, and the use of hand washing systems may be very new to some of them, maybe not, because some actually constantly use hand sanitizers in the social area. So how would you start saying to them that you need to actually start washing your hands more regularly? With that comes other practices issues that we have to understand. If any of you have washed your hands very regularly, you probably found that you get your skin becomes irritated. You might get rashes. So how do you overcome that? The hand dries. So you need to have a hand washing soap, which also has a moisturizer in it, or a separate moisturizer. Also, when people go into a restaurant, they want to sit down, but the tables are close to each other. So can you actually have every other table empty? Yes, but you could also have a barrier between them, like a cubicle created. You can have the same for the kiosk or delivery. Same applies when going to the counter. So there are many different ways that you can do this. And this kind of system has already existed. When you go to buy a ticket or go to the bank, there is a barrier in front of you. For different reasons, but the same process, the same procedure, the same tools can be used to achieve another target need. So learning from the outside and not just focusing on what the food industry does is of key essence to getting best practices to overcoming issues. To wrap all of these up, I'd like to conclude with a few points for you. It is important to highlight all of the good things that you do. So do not forget that what you are doing today in your environment actually is good. So if we are providing safe food in hygienic conditions, then talk about that. Do not say that everything we're doing is new. They were adding on top of that, because it is exactly that. You're enhancing it. You're building on top of a very strong foundation. If it was not a strong foundation, no food business would survive. So it's obviously the businesses are doing really well and they're trying to improve on it. McDonald's, like many other food in the food industry, the players, in that we try to do the best that we can, but we can always do better. There's always room for improvement. And I believe it is vital that we talk about that and actually explain that we can do a better job and improving on what we're doing. Use the existing tools that are there for use and add new ones on top of that, and get it from any industry. If you go back in history, the use of microfiber cloths did not come from the food industry. It came from the automobile industry. This is the way you actually, the last thing you do to a car is you polish it with a microfiber cloth to remove all the dust. Now we use it in many, many areas of our food preparation areas because they're very effective in removing any kind of debris or bacteria or any kind of chemicals or whatever that we want. Is very, very good to use. The use of checklists that we have in auditing, the checklists we have in preparation, getting ready, making sure that people are healthy when they come in, making sure that they have understood about all the procedures in any kind of situation. These checklists, they were not created by the food industry. They were created actually by the aeronautics industry, just like HACCP was created by NASA, for example. So we have to pull onto any other source of information and add it to our own inventory of tools to make it better. And again, adding on top and making it a stronger case. Recording and automating wherever possible. We are now in the digital world. Use of pen and paper is something that is not so common to our young adults today. In fact, there was a study done recently that showed that quite a large number of young adults don't even own a pen anymore. And they don't actually know how to write. Their handwriting is very bad because they're typing everything, or they're actually on their phones or on their smart equipment. So we have to consider automation, not just because the people that we are using, so the ones we use in our restaurants, who are our crew, who are the foundation of our business, they are not used to actually writing on paper. I am, but I am old, so and I do the old style, but my children are not. For example, my children, they do their homework on the computer. Very rarely do they have a notebook to write in these days. With the pandemic, with the virtual world that we live in today, it has become even more important to use the automation systems and digital and virtual systems. If you record things automatically, you remove a lot of time and hands-on effects. So imagine automatically measuring the air temperature, the product temperatures. This is something that we are doing as McDonald's to reduce the burden on the actual staff and also have a better assurance of safety, because we can actually rely on that not being forgotten, reduces training, and we have the facts always recorded and can access them very easily. Maintaining initiatives, but adding new ones on top of that. Initiatives such as provision of new and innovative training methods. Having different ways of conducting training programs. You don't have to be there face to face. You don't have to be there next to somebody taking them through it. You can do this virtually. We have technology such as glasses, smart glasses like Google Glasses, for example, that can do this. There are many different tools out there that we can use to start the initiatives forward. For example, auditing. Why not do virtual auditing? Why does auditing have to be done by a person actually physically there? It can be done virtually, can be very effective. Also, what it does help everybody who is participating in it to learn more as well. So start initiatives off. Do not hold back just because there's a crisis going on. There's always time to learn, even during a crisis. Giving the authority to your staff to actually raise the alarm if somebody's not doing something right. It's not whistleblowing, it's actually helping everybody out. So as a simple thing, watching somebody not wearing their mask or face covering properly, or not using the gloves properly, or not keeping the social distancing, or even not cleaning the high frequencies that they need to clean, for example. Actually raising the alarm, because they do this to protect everybody. It's not just about protecting themselves, it's about protecting everybody. We work together on this, we can achieve all of these quite easily. And last but not least, educating the staff and the customers. There's never a time where education cannot be positive. Education is the core value to moving forward, and it's learning about how we need to understand what the current situation is and how to overcome the issues and how to move forward. Giving knowledge is one of the best gifts we can give to anybody. We learn, we pass on, and we learn more and we pass on again, and we keep moving forward. It doesn't have to be just for our staff, it can be for our customers too. And why not? If we have the knowledge, we should always pass it on to as many people as possibly can be done. So we have to consider how do we actually make sure we have protected our people? Well, we can do it through highlighting the good and the new, educating, providing personal protective equipment, and providing the right tools for them to be able to maintain safe and healthy. Thank you very much for listening. I hope you're still here. I see the numbers are still relatively there. I would like to pass on to Derek or Dr. Sylvain.
Thank you, Dr. Porkamelian. Outstanding overview. And with that, Dr. Charlevoix, I will pass it to you and take it from here.
All right. Well, thank you very much, Derek, and thank you, Bijan, for the great presentation. First of all, I want to thank Ansel for organizing this seminar, but most importantly, I want to thank the food industry. And since Bijan is joining us today, I want to thank McDonald's, amongst other companies, for the work that they've done throughout this pandemic. And certainly assure you that I've been quite impressed with what's been happening over the last 6 months. Knowing a little bit about food supply chains, it hasn't been easy. Still, we've seen some innovative initiatives coming out. We've seen some changes, some pivoting. A lot of companies have adapted to this new reality, and it's just been amazing to watch. So I just want to thank you, thank McDonald's, and thank everyone who's joined us today who are part of the food industry. You've done a fantastic job, and so and Canadians and people across the world really appreciate it, because this is a global pandemic, which is quite unique. It affects the entire planet all at once. And what's unique about COVID is that it really affected both the supply and demand side all at once at the same time, which is highly unusual. I know that a lot of analysts have actually looked at the Great Depression or the Great Recession that we had that we experienced in 2008 and 2009. It was very different because this situation is very much global. It is a public health crisis. And Bijan talked about education, and of course, I'm in the business of education, so I can't agree with Bijan more that education is a very powerful thing. But the one thing that I've come to realize as a communicator, as an academic, as a researcher, what we do at our lab at Dalhousie is to look at the future of food. And of course, a lot of people have come to us to ask questions about the future of food. What's going to happen? What are the trends coming? How people will behave? But at the center of it all is education. The information that we convey to people. And I must say there's been a lot of confusion, whether it's coming from public health officials, whether it's in Canada, the United States, or elsewhere. Companies, we're now seeing groups defying protocols, measures, and of course businesses have to manage anxiety. They have to manage a clientele that is utterly confused. We actually came into this pandemic not knowing much about this virus, and as Bijan said, absolutely, we've had tools in place before. We have to develop new ones, and of course, as we did that, as we're doing that, we have to reassure the public. At the very beginning of the pandemic, I must say, I've been to restaurants. I've never stopped visiting restaurants, including McDonald's. But what I've noticed at the very beginning is that you walked into a restaurant and the restaurant looked like a crime scene. It was just very different, and it wasn't really welcoming a whole lot. But now we're into September, almost into October. We've learned how to deal with this risk. We know how to manage the risk, and we also know how to make sure that we can maintain a place that is open. But the other issue that I don't think that Bijan addresses, this whole issue of delivering food. So we've been talking a lot about food being consumed onto one place, but there are several phenomena happening right now that weren't happening 6 months ago that are going to complicate things from a food safety perspective. And so I want to talk about, obviously, e-commerce and how that's going to be driving business over the next little while, and how it's going to change how businesses manage food safety risks. Obviously, packaging, that's a big one. I want to talk about risk communication as well. And finally, we'll touch on traceability and this whole issue of food fraud, which is emerging around the world as a problem as a result of COVID. So let's start with the market itself. People are anxious. The economy is experiencing some sort of downturn across the board. Inflation rate is basically at zero, but food is getting more expensive. I did notice on menu prices that prices are going up. Bijan is right. McDonald's actually did recalibrate its menu. There are fewer choices. It's everywhere like that. However, I didn't see McDonald's raising prices, but many other companies did in order to actually run profitable businesses. And hard to blame them, but prices are going up right now, and that's certainly a concern from a food security perspective. This other issue that is happening right now that I think is getting some attention, but not enough, because you have the anxiety related to the virus, which is changing the food service industry. You have the economy as well, which is going to impact the industry as well, and all the protocols that were put in place, keeping people away from restaurants. And finally, you have telecommuting, people working from home. Your address won't matter as much. And so companies, businesses are starting to learn how to really get to the money instead of just waiting for the money to show up at their doorstep. And that, though, there are huge implications. When you actually are serving, you are protecting a brand in someone else's home. So when you actually have people come into your kitchen, that's one thing. But when you're delivering, and what we've seen over the last 6 months is an increase in use of plastics, styrofoam, at least in the Western world, because people wanted to feel safe. We didn't know much about the virus. They went back to plastics. The use of plastics has gone up. The use of styrofoam has gone up because restaurant operators wanted to go to the money to deliver food to people's homes. Of course, there are environmental implications, and I actually know that McDonald's and many other companies do value sustainability a great deal. So this is the one challenge that COVID is presenting, is how do you actually reassure your clientele, making sure that they have access to safe food, but at the same time you need to also mitigate risk related to the environment, for example. Because over the last 6 months, I think the focus has been very much on public health, but things will shift again. Things will shift back to other issues that we think is important in our lives, like climate change. And so companies will have to think differently about packaging, I think, to deliver food to people's homes at the right temperature, because sometimes you have to commute a whole lot. People who are telecommuting, are working from home, will go out less, but may still want to go out in by ordering. And how do you actually replicate that experience you would offer to your customer in your restaurant, but in their homes? I've ordered food, and I know many of my friends have ordered food to their homes in the last 6 months, and the experience is subpar. As far as I'm concerned, it may actually be satisfying for a lot of people, but I do expect standards and expectations to change over time. There is more traffic online than ever. There's more competition. What COVID has done, it has made the supply chain way more democratic. Everyone has access to the consumer now because the consumer is more and more online. And so companies like McDonald's and other companies are actually trying to generate more business by actually generating more business online. And we don't think it's going to stop. It will only continue. So to actually bring home that experience is going to be a huge challenge as we try also to match expectations also when it comes to the environment, pricing, and everything else. So it's going to get complicated quite a bit. So technologies do exist, but here's the thing. If you are to change your packaging strategy, it will come at a cost right now. And so there are technologies out there, but you're going to have to pay the price. And you're going to have to make some compromises along the way when it comes to your menu prices as well, just to keep your food safe as much as possible. So the economics of food safety in food service in particular are going to be quite challenging to manage, I think, coming out of COVID, just because the clientele, the marketplace is shifting a little bit. And we're not talking about a huge shift, a massive shift. People will still go out. People will still go to the grocery store. They still go out to the restaurant. But the industry is getting better at delivering. There are more and more food apps. Just yesterday, I learned that there's a new company that actually is guaranteeing clients in a major city, Winnipeg in Canada, food delivery from anywhere almost in town in 30 minutes, which is incredible. So you can see that really a lot of companies are upping the ante. But as a risk assessor, I guess, you have to think about food safety. You have to think about how it's going to be executed, how companies will honor that promise. It's going to be more, there's going to be more and more tension and more pressure put on them. So packaging to me is a big deal. The other issue is risk communication. Going back to Bijan's point, I think it's super important during a crisis. How do you deal with a clientele that is confused? That's going to be a challenge, and that's going to continue for quite some time. There are a lot of noise out there. There's lots of noise around COVID, but to actually filter through, to actually cut through that noise and connect with your customer is going to be a very difficult thing to do. So of course you have to train your folks, you have to train your employees, but connecting with that customer while that customer is at home consuming a lot of data coming from social media, and a lot of it is utterly dangerously inaccurate. And so how do you cut through? It's very difficult. So you really need a clear risk communication strategy, supported, of course, by public agencies. In Canada, of course, it would be the Canadian Food Inspection Agency. In the U.S., I think the CDC has done a really good job informing the public. The CFIA in Canada, less so, I think. There's been some ambiguous messaging or little messaging. I'll just give you an example of one survey we did as a lab in recent weeks. 14% of Canadians actually have thrown away food believing that the food was contaminated with COVID. 14%. And when you look at the science that we know now, nothing should drive someone to throw away perfectly good food thinking it was contaminated with COVID. So there's a lot of irrational behavior out there that you need to also keep in mind as an employer, as a company, and as a regulator as well. But it's out there. People are scared. People are very scared because of the virus, and that's something to keep in mind. The other issue, of course, is related to how do you communicate risk in a time when media is overwhelmed. Right now, media all over the world is overwhelmed with COVID because of COVID. Communicating, connecting with people is very difficult. So when you have a problem, when you have a recall, when you have anything going on, it's very difficult to connect. And so I think COVID will force companies, will force federal agencies to connect in a different way through an app, for example, perhaps using AI even. In Canada, the Canadian government actually has been able to develop a COVID app, allowing people to know whether or not they've been exposed to someone for a while who has just been diagnosed with COVID. And when I'm thinking about recalls or food safety issues, I'm thinking, well, why can't we do that with food recalls? And in the summer, of course, there was a major onion recall in Canada in the middle of August, where people don't necessarily consume news all that much. And onions are consumed raw. They were contaminated with salmonella. And so how do you connect with the public? And as a result of that, there were more people that actually fell ill as a result of consuming these onions because they were bought. Retailers actually were ahead of the game, but consumers who are very much part of the supply chain were at home with these contaminated onions. And so in many cases, it was too late. They didn't hear the news because there's so much noise around COVID and the economy. And this is the one challenge that you have, I think, as a company and as a regulator. How do you connect with people? And I think we need to think about new technologies, applications that could actually, and applications that are supported by AI and some really sound data science, allowing people to really understand what's going on. So, and that's a big challenge for people moving forward. Lastly, traceability. This is kind of my soapbox issue. We're not very good. Of course, McDonald's is not. That's not the case at all. I mean, by the way, in Canada, McDonald's is probably seen as the champion of Canadian agriculture, selling Canadian commodities. It's been doing it for several decades. So to recognize the origin of the food is very easy, but around the world it's not easy, which leads to more food fraud. And there's been reports in Europe and Asia that the number of food fraud cases has gone up. And so people will want to look for food integrity more so. Not probably now because it's not a priority, but coming out of COVID, I actually do expect that food authenticity will become even more important than before COVID, just because of some incidences that we're starting to hear about, incidences that are going to be affecting the trust of people. The trust of people is being challenged right now. People just don't know who to trust, and so because there's lots of messaging coming from governments, coming from industry, coming from regulators, NGOs, interest groups. It's very difficult to really maneuver around all that noise and get people to trust your message, to trust you as a company. It is going to be difficult, and so Bijan said it's education, and you can't really do that enough. It has to be constant. It has to be every day almost, through social media, through interpersonal relationships. Of course, with the face-to-face connections, it's not happening as much, but still, I think it needs to really, the focus has to be there as much as possible. And so all of this happening is probably going to be leading. I'm actually convinced that we're actually seeing the rise of a COVID generation, and of course, a COVID generation can mean a lot of things to a lot of people. But when it comes to food safety, it absolutely means that global coordination is going to be much more important. So, like when I'm thinking about McDonald's, for example, a global company. And Bijan actually did a pretty good job explaining how gloves are perceived differently versus or masks, and those subtleties are going to be becoming very critical because it is a global pandemic, which really is forcing people to connect in some way virtually, but connect and understand what else is going on in other places around the world. But the COVID generation, I think, is actually going to be seeing risks very differently. And it is going to be expecting how we manage risks to be very different too. Risks are much more systemic than perceived how they were perceived before the pandemic. Solutions are going to be seen as very different. Everything is going to be a risk. It is going to be a risk society for the COVID generation. And so solutions are going to actually be expected to address systemic issues much more so than ever before. So being collaborative, working together, working in partnerships. When I think about a supply chain, for example, when you look at packaging, when you look at traceability, when you look at risk communication, this is not just about one organization. It's about multiple organizations working, focusing on one challenge as much as possible. So there you have it. That's all from me. So I'll leave it at that, and because I want to make sure that we have some time for some questions. So over to you, Derek.
Very good, excellent. Thank you, Dr. Charlebois and Dr. Porkamelian for the great overview. I'll touch quickly, save a little bit of time for Q&A, but the big question that we're trying to answer is, what do we do with the gap between supply and demand? And how do you live in a situation where 1 in 3 people who are looking for the glove of choice can't find it? So that's putting a lot of folks into the requirement for an alternative. So quickly, where is the added demand coming from? It's across the board. Healthcare applications, of course, number one, have grown substantially. Number two, industrial applications. So not only where people were using gloves before, but now in many cases, the entire workforce is also using PPE for a viral protection and to help prevent the spread of COVID-19. Three, we're seeing new applications in just general public. More people, very common now to see someone walking around with a mask on, wearing gloves. We're using these for cleaning protocols, whether it's household or in our businesses, and even in shopping situations. So across the board, demand has grown. Supply has yet to keep up, and we'll be well into next year before I think we can restore that balance. So what do we do in the meantime? Well, Ansel has taken an approach, and we've assembled quite a bit of information and some viable alternatives when you can't get the exact glove you need. So some of the alternatives, for example, could be chemical and mechanical gloves. These are also products that in many cases have passed viral permeation requirements. They are meeting the EN 374, ASTM 1671 requirements. So a chemical glove is also an outstanding viral barrier. These are some of the best barriers in the world. But picture this. Say a typical user is running 6 to up to 20 pairs of disposable gloves per day or per shift. In the potential alternative world, there may be one reusable pair of gloves that could last for several days. So we're reducing waste, we're providing a viable alternative. It is a little bit out of the norm. And to be clear, there are some applications where this is not going to be a viable option, particularly in the medical setting. But there are other applications where this can be a really advantageous option. So I would certainly want to encourage everyone to reach out to our Ansel team. This gap is real. I know it's causing frustrations. We had one of our questions around just the frustration in getting orders and getting demand in some of the Ansel products. It may not be the exact product you're looking for, but we have alternatives. We have a summary of alternatives that have been recommended by the regulatory agencies, CDC, and we have internal alternatives that we can provide. So reach out, let us help you with an Ansel Guardian solution. And with that, Megan, I know we are down to just a few minutes, but I do have a couple
of questions, Derek. So we do have one question from the audience, and I have a few pre-submitted ones. So the first one from the audience is for Dr. Porkamelian, is what control measures has McDonald's put into place worldwide to make sure employees are following the new sanitary rules? How to make sure these risks are minimized the best it can be?
Sure. Thank you for the question. It's actually it's not a one answer. It's a combination of things. So we go back to educating people about the risks, then training them, providing the right tools, and of course, constantly monitor, coach, advise, and give them the authority and empower people to be able to watch everybody else, each other, because we all say we're all in this together. So every one of us has to make sure the other one is doing a good job and they're not missing out on anything. So everybody working together, making sure that if somebody doesn't do what they're supposed to do, another person prompts them to get it right. So if the mask is torn, tell them to go and get another mask. If the glove is coming off, get another glove, for example. Or if somebody hasn't done the actual cleaning at the right time, get that done. So scheduling those, making all the usual things that we normally do, just enhancing them and making sure that people do follow the procedure. There's no one magic bullet. It's all just working together, making sure we all follow the procedures.
Thank you. Derek, I believe the next question is for you. It is from Mike, and it is there a minimal safety mil thickness for disposable gloves that best suit COVID protection?
There is. Great question. It has been established by ASTM. We, in most countries, are following the FDA guidance at a minimum thickness of 0.05 millimeters or just over 2 mils in thickness. Standard exam gloves have been well researched and proven to be excellent viral barriers. So from there up, basic COVID protection is relatively straightforward.
Thank you. One last question, and this one is for Dr. Charlebois. Sylvain, could you let us know what the average cost of recalls are due to contamination in the food processing industry?
Great question. Of course, it does vary from one recall to another, depending on the scope, depending on the product. We've actually worked on several case studies related to the cost of recalls. It can vary from a few $100,000 to several millions of dollars. In the case, the most famous case coming out of Canada is the Listeria outbreak in 2008 that came from Maple Leaf Foods, and that recall cost $25 million. But I would say that there's been, I know of, I've actually worked with two cases that the company itself actually went under. Let's face it, in the agri-food sector, you're always one food recall away from going bankrupt. And that's the reality. And that's why you want the support. You want to use the proper precautions and proper equipment to make sure that doesn't happen.
Perfect. Thank you very much. So Derek, back to you for the summary.
Awesome. Well, thanks everyone. We'll wrap up. I know we're a minute or so over, but we are seeing this rapidly changing. I'm thankful to both of the presenters today for highlighting the need for flexible adaptation, right? As we learn, we have to change and adapt. Education and knowledge are going to be key. The sharing of knowledge, the overall benefits to society will be very important. Three, the shortages will remain, and expect costs to likely increase and continue to increase over the near term, especially with raw material shortages. Sylvain talked about some of the habit trends that have changed, the additional use of plastics, the additional use of PPE. So none of that do we expect to diminish anytime soon. And I'll finish with again an invitation. Please reach out to your Ansel representative. We're here to help solve your problems, whether it's demand shortages. We want to ensure that you are within regulatory requirements in any application. And we want to make sure that you're successful within your facility. And that may include our product offering. That can include our Ansel cares and contact tracing support, and in any other way that we can be of service to you. I will finish with a final thanks to the co-presenters and reinforcing points around our advancing education, knowledge, and in this ever-changing new COVID environment. Thanks again, gentlemen. Thanks to all the attendees for joining us today. And if you have any questions that weren't addressed, put them in the chat box, the question box on the right. We'll make sure and get an answer back to you very quickly. Very good. Enjoy the rest of your day.
Thank you. And this concludes our webinar.